If you don't have a wisdom tooth and you have a toothache on the molar side, you can suspect an impacted wisdom tooth. Wisdom teeth are the last teeth to grow in the oral cavity. When the wisdom tooth comes out, the throbbing pain lasts for several days, and then when you look in the mirror, you can see the white teeth sticking out between the gums. However, if there are no teeth visible above the gums, and the gums continue to swell and you feel a toothache, it is good to suspect an impacted wisdom tooth. An impacted wisdom tooth is a wisdom tooth that grows sideways without the teeth being completely exposed above the gums. It is better to remove an impacted wisdom tooth because it looks like there are no teeth on the surface, but with only a little exposure, it continues to grow in the gum and push the adjacent teeth. If an impacted wisdom tooth is left for a long time, it can be painful and cause many problems such as misaligned teeth, inflammation of the gums, and tooth decay. How to find an invisible wisdom tooth? If the area around the inner molars where the wisdom teeth do not grow often throb or swell, visit your dentist. Most impacted wisdom teeth are discovered through regular checkups after visiting the dentist for scaling. If the impacted wisdom tooth lying on its side has decay, the decay can move to the adjacent tooth, resulting in nearly extraction. However, the extraction process is a little more complicated than that of a general wisdom tooth because it is lying down. Impacted wisdom teeth often have roots close to nerves, so they go through a more accurate examination step to minimize nerve damage. Since it is difficult to extract the teeth at once, a process of fragmenting the teeth is necessary. Therefore, general wisdom teeth can be extracted at a nearby dentist, but impacted wisdom teeth that are very close to nerves are sometimes operated at specialized dentists. What should I do after an impacted wisdom tooth is extracted? Wisdom tooth extraction is performed under anesthesia, and even after the wisdom tooth is removed, the anesthesia has not resolved, so you should refrain from eating and drinking. If you eat food while the anesthesia has not been removed, it is easy to injure your mouth. It is good to change the gauze you are biting once when the anesthesia begins to dissipate. The pain may begin as the anesthesia wears off, but it is not unbearable. Some of the prescribed medications contain painkillers, so you can take them every hour. If you are sensitive to pain, you can take commercially available painkillers after consulting your dentist. The use of straws after an impacted wisdom tooth extraction should be avoided as it interferes with the blood supply needed to heal the wound. Inflammation may occur before the wound heals, so it is important to keep your mouth clean and not smoking. If you feel pain in the invisible wisdom tooth or throbbing gums, visit your dentist and receive appropriate treatment before affecting the adjacent teeth.